Warning: your legs are failing first. Doctor explains why it happens and how to stop it. Welcome to Dr. David's channel. Today, we're not just talking about how to make your legs stronger. We're talking about how your legs are directly related to your longevity. The strength and health of your legs are one of the best indicators to predict how long you will live, because they provide early warning signs about more dangerous issues happening deep inside your body. This message is especially important if you are over 50. If you are under 50, watch it to learn how to prevent problems and how to use your legs as a diagnostic tool for overall health. Let's look at the 7 dangerous signs your legs are trying to tell you. Peripheral neuropathy. Do you feel numbness, pain, tingling, or burning in the soles of your feet? That is often a sign of prediabetes or diabetes. The science: high blood sugar levels are toxic to the vascular and nervous systems. Because the nerves in the legs are the longest and farthest from the heart, they are the first place to be affected by a lack of oxygen and nutrition. The shocking truth: normal sugar in all of your blood should only be 1 teaspoon. If you have diabetes, that number is 2 teaspoons. This excess sugar is destroying your circulatory system. Ankle and foot edema. Do you see swelling in your feet, where pressing leaves an indentation? Pitting edema? This is a serious problem. Deeper warning: edema is an indication of poor circulation, affecting the kidney, liver, or heart. When blood pools in the legs, the heart has to work extremely hard to push the blood back up against gravity. Restless legs syndrome, RLS. Are your legs restless, especially at night, preventing you from sleeping? I once suffered from this. Root cause: RLS is often caused by a diet too high in sugar and refined carbohydrates, which depletes vital micronutrients like vitamin B1 and magnesium, leading to lactic acid buildup and cramping. Consequence: lack of sleep increases the risk of heart attack, stroke, and diabetes due to elevated cortisol. Deep vein thrombosis, DVT. Thrombosis is a dangerous blood clot. Over 90% of all heart attacks and strokes are caused by a clot, not just plaque buildup. Greatest risk: a clot breaking off from your legs and traveling to the lungs, pulmonary embolism, which can be fatal. 2 factors that increase the risk are stress and a high carbohydrate diet. Peripheral artery disease, PAD. This is hardening of the arteries, atherosclerosis, that occurs outside the heart, specifically in the legs. Mechanism: the single-layer cell lining inside the artery, the endothelial layer, is damaged by high sugar or inflammation, leading to artery stiffness, narrowing, and plaque formation, acting as the body's band-aid. Chronic venous insufficiency, a condition where blood pools in the veins due to a sedentary lifestyle. Signs in the legs: discoloration, browning effect, hair loss, thinner skin, and edema. Stagnant blood puts more pressure on the heart. Sarcopenia, age-related muscle loss. This is age-related muscle loss and is one of the top predictors of mortality as you get older. Role of muscle. Muscle is a crucial metabolic organ that helps burn off sugar. Losing muscle means losing an important buffer for longevity. If you have blood sugar issues or peripheral neuropathy, you must change your diet. Functional recovery. Switch to a low-carb diet and practice intermittent fasting. Research has shown it can completely reverse type 2 diabetes in just 10 weeks. Nerve repair. Use benfotiamine, a fat-soluble form of vitamin B1, and alpha-lipoic acid. These 2 supplements have been shown to work wonders in helping to heal damaged nerves. To address fluid pooling, edema, and chronic venous insufficiency due to a lack of movement, you need muscle to push blood back to the heart. The soleus muscle. This part of the calf muscle is called the second heart because it efficiently pumps blood without tiring. Soleus push-up exercise. You can perform this exercise even while sitting. Imagine straightening your ankle joint and pressing lightly on the ball of your foot. Perform the movement rhythmically and continuously to activate blood pumping and reduce stress on the heart. To protect the endothelial layer of the arteries, combating PAD, and reduce edema, we need nitric oxide and potassium. Increase NO. Vasodilation. NO helps relax and expand arteries. The best ways to increase NO are exercise, sunlight, nasal breathing, and foods rich in nitrates like arugula and beets. Dr. David's tip: I combine organic beet powder with cocoa powder, rich in polyphenol, to maximize NO. Potassium, anti-edema. Potassium is a natural diuretic, helping to push excess fluid out and offset the effects of sodium. We need 4,700 milligrams of potassium every day. Increase high potassium foods or use an electrolyte powder. Muscle loss is a combination of aging, poor nutrition, and inactivity. Solution: a combination of animal protein and regular exercise. Strength challenge, sitting rising test. I encourage you to try this test. Can you sit down and stand up from the floor without using your hands? This is an excellent indicator of your core and hip strength. If it's difficult, start by practicing basic squats using a chair or box. The health of your legs is not just about walking. It is about your freedom and longevity. Listen to these 7 warning signs and start taking action today. Have you experienced any of these signs in your legs? Please comment below and share your experience. I want to hear your stories and your victories. Most importantly, please subscribe to Dr. David's channel and share this video with a loved one. You never know whose world you might open just by reminding them that strength is always waiting to be awakened. I wish everyone a wonderful day.